Hi, I'm Gabriel with Verywell Health. We're committed to bringing you the latest health information, empowering you to take charge of your well-being. Did you know that the 5-year survival rate for localized breast cancer can exceed 99% when caught early? That's why early detection through self-awareness and regular screenings remains our strongest defense against this disease. In today's video, we'll cover the 10 earliest signs you should never ignore, because knowing your body could save your life. All right, let's dive right in. Perhaps the most common sign of potential breast cancer is discovering a new lump or mass in the breast or underarm area. Now, I know discovering a lump can be scary, but it's crucial to remember that most lumps are benign, meaning they are not cancerous. However, you should never ignore them. These lumps can feel different ways. Some are firm and painless with irregular edges, while others might feel soft or even tender. The key here is that any new lump, regardless of how it feels, warrants a visit to your doctor. Think of it like this. Your breasts have a normal landscape. Any new bump or change to that landscape needs to be investigated. Don't try to diagnose yourself. Let a professional determine if it's something harmless like a cyst or something that needs further attention. Early detection is key, so even if you think a lump is nothing, get it checked out for peace of mind. Your health is worth it. Moving on to the second sign, which can be a bit trickier to detect, and that's a general thickening or swelling in part of the breast without a distinct lump. You might be thinking, well, how is that different from just normal breast tissue? Good question. This thickening often feels different. It might feel like an area of firmness or fullness that wasn't there before. Imagine pressing your fingers gently against a sponge versus a piece of fruit. The sponge will have that give, while the fruit will feel more solid. That subtle difference in density is what you're looking for. If you notice this thickening persists for more than a couple of weeks or coincides with other symptoms, it's time to see your doctor. They can examine the area, ask about your medical history, and determine if further investigation is needed, such as a mammogram or ultrasound. Early detection is all about paying attention to these subtle changes in your body. Our next sign is visually noticeable and involves changes in the skin's texture. We're talking about dimpling or puckering of the breast skin, often compared to the texture of an orange peel, medically termed peau d'orange. This dimpling occurs when something pulls on the ligaments beneath the skin's surface, causing that characteristic puckering. Imagine those ligaments like tiny ropes holding the skin taut. When a tumor grows, it can tug on these ropes, leading to the dimpling effect. While peau d'orange can be a sign of breast cancer, it can also be caused by other conditions like infections or inflammatory breast conditions. If you notice this dimpling on your breast, even if it's a small area, consult your healthcare provider. They can assess the situation, consider other symptoms, and recommend the appropriate tests to determine the underlying cause. It's always better to err on the side of caution when it comes to your health. Pay close attention to this next sign because it's one we often overlook. It's perfectly normal to have one breast slightly larger or shaped differently than the other. However, a sudden or noticeable change in breast size or shape, especially in one breast compared to the other, is something to be aware of. This asymmetry could be a red flag, potentially indicating a growing mass that's altering the breast's natural contour. This change might happen gradually over time or appear more abruptly. If you notice one breast becoming significantly larger, fuller, or changing shape compared to its usual appearance, don't ignore it. Changes in breast size or shape, even if they seem insignificant, warrant a conversation with your doctor. They can help determine if the changes are due to hormonal fluctuations, weight changes, or something that requires further investigation. Your body is constantly sending you signals. Let's talk about nipples for a moment. Specifically, we're discussing nipple retraction or inversion, which is another sign you should never ignore. Typically, nipples protrude outward. However, when a nipple turns inward or becomes retracted, especially if it previously pointed outward, that's a red flag that needs attention. This inversion happens when something tugs on the delicate ducts behind the nipple, causing it to draw inward. Think of it like a drawstring bag. When you pull on the strings, the opening cinches closed. Similarly, tumors can pull on the milk ducts, causing the nipple to retract. If you notice a recent change in your nipple's direction, whether it's a complete inversion or a flattening, it's crucial to get it checked out. Early detection is key, and noticing these changes early can make a significant difference. We're all familiar with occasional skin irritations, right? But when it comes to our breasts, it's crucial to differentiate between a harmless rash and something more serious. Persistent redness, flaking, or scaling of the breast skin, especially if it doesn't improve with over-the-counter creams or lotions, could signal inflammatory changes beneath the surface. If you notice persistent redness that doesn't go away, especially if it's accompanied by other symptoms like itching, burning, or thickening of the skin, it's time to see your doctor. One particular condition to be aware of is Paget's disease of the breast, a rare type of cancer that often presents with redness, flaking, and crusting around the nipple resembling eczema. While Paget's disease is relatively uncommon, it highlights the importance of paying attention to these skin changes and seeking professional evaluation. Your skin often provides visible clues about your internal health. Don't hesitate to reach out to your healthcare provider if you have any concerns about skin changes on your breasts. Let's talk about another common concern, nipple discharge. Any nipple discharge that's not breast milk, especially if it's bloody or clear and occurs in only one breast, requires prompt evaluation. This discharge can range in color from clear to milky, yellow, green, or even bloody. While some nipple discharge can be benign, caused by hormonal fluctuations or certain medications, it can also be a sign of underlying conditions like infections, ductal ectasia, or even breast cancer. If you experience any nipple discharge, don't panic, but don't ignore it either. Make an appointment with your doctor to discuss your symptoms. Depending on their assessment, they might recommend further tests, such as a mammogram, ultrasound, or a ductogram to determine the cause of the discharge. We often associate pain with something being wrong, right? And while it's true that many breast cancers are painless, persistent pain localized in one area of the breast or nipple should never be ignored. This pain might feel like a sharp stabbing sensation, a dull ache, or a burning feeling. It's important to differentiate between cyclical breast pain, which fluctuates with your menstrual cycle, and pain that's constant or unrelated to your period. If you experience persistent breast pain, especially if it's in one specific area and doesn't go away, it's crucial to consult your doctor. They'll want to rule out other potential causes of breast pain, such as a muscle strain, a cyst, or an infection. While persistent breast pain doesn't automatically equal cancer, it's always better to err on the side of caution and seek professional evaluation. Now let's shift our attention to a crucial part of our immune system, the lymph nodes. These small, bean-shaped glands play a vital role in filtering out toxins and fighting off infections. When it comes to breast cancer, swollen lymph nodes, particularly those under the arm or near the collarbone, can be a sign that cancer cells have spread to nearby lymphatic channels. This spreading doesn't necessarily mean the cancer is advanced, but it provides valuable information about the extent of the disease. If you notice any swelling or lumps in these areas, especially if they're tender to the touch, don't panic, but do bring it to your doctor's attention. They'll examine the lymph nodes, consider your medical history, and recommend further tests if necessary to determine the cause of the swelling. And last but certainly not least, we need to talk about nipple rash or crusting. While that's certainly possible, a persistent rash or crusting on the nipple, especially if it resembles eczema and doesn't respond to over-the-counter treatments, could indicate a rare type of breast cancer called Paget's disease of the breast. Paget's disease often starts with changes in the nipple and areola, the darker area surrounding the nipple. You might notice redness, itching, burning, flaking, crusting, or even a discharge from the nipple. If you experience any persistent nipple rash or crusting, don't hesitate to schedule an appointment with your doctor. They can examine the area, consider other factors like your medical history, and recommend further tests if necessary to determine the underlying cause. Early detection saves lives. Guys, we covered a lot of important information today, and I know it can feel overwhelming, but remember, knowledge is power. By being aware of these potential warning signs, you're taking a proactive step in safeguarding your health. These signs don't automatically mean you have breast cancer. Lots of things can cause these changes, and your doctor is the best person to figure out what's going on. So if you notice any of the signs we talked about, don't freak out, but don't ignore them either. Stay informed, stay healthy, and I'll see you in the next video.